Also am a member of the Seneca Nation of Indians, originally from the Cattaraugus Reservation, and currently live in DC, so I am an urban Indian. Also, to be here to provide the Office of Urban Indian Health Programs update. In addition to the staff at the office, I also, as you know, we have a lot of the area urban coordinators. And it's because of the area urban coordinators in the areas who are your, so most of the time, your first contact with various activities and updates and solving your questions. They are really key to the connection of your programs to us. So I'm really thankful for the area coordinators and also the area directors who are here today. As Donna mentioned, we will be having a IHS closed session later this afternoon. It's a separate meeting for all the IHS individuals. And we're really going to be focusing on the confer policy and also the activities of the urban Indian health programs. And again, this is really to focus in on, as the theme has been this morning, the partnership between IHS and the programs. As I was beginning to reflect on my time as serving with, as the acting director, and thinking about the theme and what we're going to give as an update, I remembered when I first joined the office, first weekend, I was like asking Sherry Ann and Rick, you know, I'm here, I've read and have background in Indian Healthcare Improvement Act, but really what should I be doing in my weekend assignment? And it was really going back to the Indian Healthcare Improvement Act and rereading and digesting the Title V of the Indian Healthcare Improvement Act to really get a sense of the programs. And for preparing for this update, I even went back and was looking for some historical documents in the history about the passage. And it's almost 40 years ago that the Indian Healthcare Improvement Act was passed. And so I came across President Ford's presidential documents. And when he signed the Indian Healthcare Improvement Act, he released a statement in which he said, I am today signing Senate Bill 522, the Indian Healthcare Improvement Act. The bill is not without its faults, but after personal review, I've decided that the well-documented needs for improvements in Indian health, manpower, services, facilities outweigh the defeats in the bill. While spending for Indian health service activities has grown from $128 million in fiscal year 1970, that's amazing, to $425 million in fiscal year 1977. Indian people still lag behind American people as a whole in achieving and maintaining good health. I'm signing this bill because of my own conviction that our first Americans should not be the last in opportunity. And I think some of that spirit still rings true today, that the programs, Indian Health Service, the urban programs, have been established to create and address the health needs of urban Indian health program, or urban Indian individuals. And it really is, now looking back, just this humble beginning of this program. But we look to today, and nearly 40 years later, the urban health programs are strong, and they're continuing to grow and addressing the health needs of American Indians and Alaska Natives. So today, the urban health program budget is $43 million, and based on the last reported data that was submitted to IHS through the former UDS system, we had 33 programs serving 126,000 patients, including 53 American Indians, Alaska Natives. The programs themselves employed 1,600 full-time employees, and they performed 530 visits which include medical, dental, behavioral health, other professional enabling services directly or paid referral. And this is the snapshot that we have in our hands right now at IHS. But we know from discussing with you, from the confer letter, from our discussion even yesterday with the NCUIH board, that this is not completely capturing the complete picture of the programs and all the services that you do and all the people that you may be seeing. So we've heard a lot about the transition, and again, really, you can mark the date of this transition, of moving when this kind of all has happened, and it was with the confer policy that was enacted in September of last year, just about 9 months ago. We're all giving born to a new urban Indian health program here. But with the confer policy, as mentioned, there's been 4 confer letters issued, 3 confer sessions with the IHS director, but also numerous area sessions that have occurred between the programs in the area and the area staff. There's a budget increase and updating the program reporting. And again, that's been a critical discussion, and it's going to be an ongoing discussion for the coming year. So in just this time frame, there's been a lot of activity, a lot of transition, but a lot of things that we're moving forward with, and it is quite an exciting time. And I've shared on a couple of calls already that this is the new era for the urban Indian health programs, from my opinion. So thinking about the future of the urban Indian health programs, and again, next year we will be celebrating the 40th anniversary of the Indian Healthcare Improvement Act. What will we be saying then, 1 year from now? And I agree with everyone that having a room filled of individuals who are supporters, participants, and advocates for the urban Indian health programs is a great goal. But also from where we sit at the Office of Urban Indian Health Programs, we can say that indeed we will have some type of improved data reporting. We've been working internally, looking at what we have, but we also look forward to what the NCUIH board has been gathering with all the survey results that you've been sharing. Combining these efforts will help develop the next stage of program and data evaluation for the programs. Also, I would definitely echo that we have I would say it's been a great partnership. I've experienced while sitting in the seat, I think we'll even have a stronger partnership. The confer policy is in place. One of the things that I wanted to echo about that is that indeed we've had letters and we have opportunities to have confer sessions. But if you do have an issue or there's a topic that you have that's affecting your program, sending an email to the confer address will help to raise it to the level to us at IHS headquarters to help facilitate discussion, address the issue, and have that conversation that we want to engage in with the programs to address that issue. Another more informal way of addressing the dialogue and the partnership between the programs and the Office of Urban Indian Health Programs is also our monthly calls. We have them every month on a Wednesday, and we're always looking for topics to not only provide you with updates that you need to hear from IHS, but also have those discussions and that dialogue with your programs on what are those critical issues, or even sharing between the programs best practices. This is the venue for you to do that on a national basis. If there's things that you would like to address, even outside of that monthly call on having a specific training, please let us know. We had some discussion about that with the NCUIH board yesterday on the upcoming audits and the revisions of that. So we wanted to ensure that we're providing you with the information and the training that we have available to us, both at headquarters but also in the areas. And then I left the last box empty because I really am, there's a few goals that we want to change, but where are the goals and changes that you want to happen for yourself at the programs, but also for us? And that's for us to all determine together. So with this, I really want to challenge all of us to define the future and define that together. And this last slide is kind of my own reminder for myself, and I wanted to share that with you. As mentioned, I'm a member of Seneca Nation, part of the Iroquois Confederacy, and one of the principles or values that are passed along is that when you take action, you think about the next 7 generations. And this little reminder here is my own family, 5 generations before me. The little one in the middle is my mom, and it's because of their actions and their support and the things that they've done is the reason why I'm here today. And I really do appreciate that. But we all stand and sit within our own communities, whether it's your family, whether it's your program, whether it's us nationally as the Urban Indian Health Programs. And what do we want for the future of this program? So with that, I would thank you all for your time.